Welcome to our channel. Today we are discussing a more serious health disease that every dog owner should be aware of. That's Parvoviral gastroenteritis, commonly known as Parvo. This highly contagious disease may be life-threatening, but with early detection and prompt treatment, many dogs can recover. Let's dive in and learn more about this devastating disease. Parvoviral gastroenteritis is a severe and potentially deadly viral infection that primarily affects puppies and unvaccinated dogs. It is caused by the canine parvovirus, which is highly resistant and can survive in the environment for months and even years. The virus attacks the most rapidly dividing cells in the body like bone marrow, lymphatic tissue, and gastrointestinal tract. This results in severe damage in intestine leading to diarrhea, vomition, dehydration and immunosuppression. If you notice any of these symptoms, it's crucial to seek veterinary care immediately. Treatment for parvoviral gastroenteritis is supportive and focuses on addressing electrolyte imbalances, dehydration, and secondary infections. This may involve hospitalization, intravenous fluids therapy, anti-nausea medications, antibiotics, and nutritional supplementations. The signs and symptoms of the disease parvoviral gastroenteritis may vary with the severity of the infection. Common symptoms include loss of appetite, severe and bloody diarrhea, vomition, lethargy, and fever. Prevention of parvoviral gastroenteritis begins with vaccination. Puppies should receive vaccination at the age of 6 to 8 weeks, with second injection after 21 days and a booster dose annually. If there are any unvaccinated adult dogs, they should be vaccinated immediately and a booster dose should be given annually. It's also essential to practice good hygiene, avoid contact with infected dogs, and disinfect the contaminated area to avoid virus spread. Thank you for watching. If you want this video helpful, don't forget to subscribe our channel, give a thumbs up to this video and share with other pet owners.